Hi there, this is Dr. William M. Chansa, and in this video we'll continue with our laboratory values and investigation. Specifically, in this video, we're going to focus on coagulation and lipid profile. So let's go. Okay, so we've got two components like I mentioned earlier. We've got the coagulation studies and the lipid profile. I'm going to begin by discussing the coagulation studies. And there are just 5 important parameters that you have to remember or memorize, especially 2 all the way up to 5, you have to know them. Okay, the first one I'm going to begin with is platelet count. So platelet count is very, very important. Very important to know platelet count. So platelet count, the normal is 150 to 400. Forget about the constant, which is 10 to the power 99. Forget about it. So just remember 150 to 400. Okay, that's the normal platelet count. Now, the other name of platelet count is what is called thrombocytes, right? Thrombocytes. So if your platelets are less than 150, we call that thrombocytopenia. And if your platelets are more than 400, we call it thrombocytosis. So you have got different conditions that will give you elevated platelets, and you're going to have conditions that will give you reduced platelets. So you need to be aware of that. And then after that, we move to D-dimers. So what are D-dimers? D-dimers, remember once the body has formed those clots, right? The body has been formed in the way that it does everything on its own, except that sometimes it fails. Okay, so once clot formation has occurred, what happens is that the body will degrade those clots that have been formed. So after the degradation of the clots that have been formed, there is what is called fibrogen or fibrin degradation products. For fibrin degradation products, these are the products that are formed after what thrombolized or degraded what fibrin. Okay, and the proteins that are formed, some of the proteins that are formed are a lot, but the most important one that you guys have to remember is what is called D-dimer. So a D-dimer is just a fibrin degradation product. That's what you need to remember about D-dimers. Okay. So now the normal is less than 500 microgram per liter, and if you find that it's elevated, it tells you to say this patient is what? This patient is having their clots thrombolized, okay, or degraded. And then the D-dimers, if they are less than 500 microgram per liter, pulmonary embolism is unlikely, because you know to say if the patient has got a clot in the lungs, their body is supposed to hemolyze it or degrade it, okay, and therefore expect the fibrin degradation product to be elevated in the blood. But in this case, if it's less than 500, you start ruling out PE. Okay, but remember in medicine, never say never. Okay, and then you have got the third parameter that I'll talk about is what is called prothrombin time, and the normal is 11.5 to 13.5. The question that they ask is that what is prothrombin time? What does it signify? So it just signifies the time it will take for a clot to be formed once the extrinsic pathway has been activated. Okay, so in layman's terms, for you to understand the extrinsic pathway and the intrinsic pathway, you have to remember the coagulation study. But remember, the extrinsic pathway is just made up of what? It's made up of 3 parameters. Okay, it is made up of 3 parameters. It is formed of what? It is formed of by what is called protein number 7. Okay, number 7, number 2, and number 3. So those are the things that make for what is called yeah. So now we're saying the extrinsic pathway is composed of factor number 3, 7, and then they convey under factor 10. Okay, so like the prothrombin time, it tells you about the time it will take for a clot to be formed once that the extrinsic pathway has been activated, and it's fast. It starts between 11.5 to 13.5. Okay, but you know the bad part about the good part about the prothrombin time is that it's very fast. Okay, in short, it tells you about the extrinsic pathway, and that means the extrinsic pathway is more faster than what the intrinsic pathway. What do I mean? What I mean is this: you've got what is called the activated partial thromboplastin time. Okay, and the INR, we'll talk about INR the last thing. Now, what is the activated partial thromboplastin time? So the activated partial thromboplastin time, it tells you about the time it takes for a clot to be formed in the intrinsic pathway. Okay, So the intrinsic pathway can be memorized using the mnemonic TENET, TENET. So factor 12, 11, 9, 8, and 10. Okay, those factors, they comprise or they constellate what is called the intrinsic pathway of the coagulation cascade. So the activated departure from plastin time, it tells you the time it will take for that clot to be formed once that intrinsic pathway has been activated. And the normal is 26 to 37. So that's what I meant. That's what I meant by saying that the extrinsic pathway is faster than what the intrinsic pathway in terms of how long it will take for a clot to be formed. Okay. Now, the last one is what is called international normalized ratio. So international normalized ratio is calculated. Okay, it's calculated. What do I mean? What I mean is simple and straightforward. The INR is formed from the prothrombin time. The question is, how do they come up with it? So in short, there is what is called the standardized prothrombin time, which is 11 to 13.5. That's the norm. Standard. Everywhere you go, it's 11.5 to 13.5. That's the standard prothrombin time. So now if they want to calculate the INR, what they will say is, let's say we have got patient B, okay, or patient F. So patient F comes to the hospital today, and then you order for prothrombin time. So after you've ordered for prothrombin time, and it turns out that it comes as a, for example, it is in the range of 15. Let me say 15 to 16, or let me just say it's 15. How you're going to reach to the INR? So what you do is you determine the ratio between the standard INR over the one that you've calculated. You determine that ratio. So standard INR, which is 13, divided by 15, then you come up with a value. Okay. So if you find that the standardized ratio that you calculated is more than, it's between 1 to 1.3, then that's normal INR. Then if it's more than that, then it means that you've got an increased INR. Remember we talked about INR also under liver disease, and we said under liver parameters or other liver function tests, we talked about INR. So we said it's also a stigmata of chronic liver disease. If the liver has been diseased for a long time, the INR is what increased. Why? Because most of the proteins that are part of the coagulation system, they are formed in the liver, and if they're not there, it means that clotting will be taking very long to occur, and therefore you're going to have what is called an increased INR, and that tells you to say this patient is going to be prone to what? To bleeding. Okay, so the significance of memorizing 1 to 3 is that if these numbers are increased, then it means that the patient's blood is taking long to clot, and therefore if you were to injure them, okay, to injure them right away, you injure them, it will take a it will take very long for them to what? For their blood to clot, and therefore they'll be prone to bleed, or they'll bleed a lot once you injure them. So that's the significance of memorizing these values. But remember, the activated partial thromboplastin time is for intrinsic pathway, whilst the prothrombin time is for extrinsic pathway, while the INR is calculated from the prothrombin time, and I've explained in details of how you come up with the values. D-dimers have explained, platelets have also explained. So now we move on to the next component, which is the lipid profile. Okay, so welcome back to the second part of our today's class. So we've discussed coagulation studies. Now we are moving on to what? To lipids. So under lipids is what is called the lipid profile. So everything that I had put, I did not organize them nicely, but I'll tell you the most profound things that you guys have to know. So if they ask you to say what are the components of the lipid profile, you should be able to mention the following that I'll mention. Number one, total cholesterol. Okay, total cholesterol. So the normal total cholesterol is between 3.5 to 6.5. So others will use what? They use other parameters, and it's okay. So it's okay. Now that's the first part of the lipid profile. The second one is called triglyceride. So triglyceride is supposed to be your second part of the lipid profile. Okay. Then the third one is what is called the lipoproteins, and there are two that you get: the low density lipoprotein and the high density lipoprotein. So these four, they constitute what is called a lipid profile: total cholesterol, triglyceride, lipoproteins, of which there are two: high density and the low density lipoproteins. Now, what is the normal? So now, what is the significance of knowing the high density and low density lipoproteins, or what's the difference between the two? So the low density lipoprotein is also called the poor cholesterol, while the high density lipoprotein is called the good cholesterol. And the reason why the high density lipoprotein is called the good cholesterol is because of the functions that they do. Number one, they carry what? Lipids or cholesterols from the all parts of the body, taking them back to the liver, so that the liver can use them for something purposeful. Okay, that's the good part about the high dense lipoprotein. But the low dense lipoprotein does the opposite to what the high dense lipoprotein does. So the low density, also called LDL, what they do is that they carry lipids, or rather cholesterols, from the liver, distributing to the parts of the body, predisposing the patient to have cerebrovascular conditions or cardiovascular problems like hypercholesteremia, atherosclerosis, and diabetes type 2. So that's a major difference. So you need to know the normal. In fact, you are not expected to know the norm of these values that I've mentioned, but you need to know that those four that I mentioned are what you call the components of what is called the lipid profile. Okay. So I hope that was helpful, and I'm also requesting that you guys continue to like, sharing, subscribing, and commenting on my videos. Thank you very much. Twalumba, Zikomo, Twatasha, Litumezi, Asante Sana, Merci beaucoup. That was Dr. William M. Chansa. Until next time, thank you.